When we look at social determinants of health for American Indian people, a lot of that can be traced to federal policy and how the tribes have been treated historically. And unfortunately, I think there are many people in this country who do not understand the history of federal-tribal relations. And there were periods of policy for the federal government that were really bad for the tribal communities. There's a period of removal, for example, where tribes were moved from their ancestral homelands to other areas. And if you uproot entire cultures and place them in a foreign land, essentially, that's going to have an impact on health. It's going to have an impact on other social factors, including self-identity and sense of disempowerment, that we can't even live where my parents lived, my grandparents lived, where hundreds of generations before me lived. That has an impact on people's self-esteem and health-related behaviors. They're also trying to assimilate people and have them move to urban settings. And when this policy was first implemented, they were taking people from traditional native cultures and placing them in large cities where they faced all kinds of discrimination. There was also a period of termination when the federal government essentially wanted to terminate tribes' status and try to essentially say they don't exist because they want them to just assimilate. Recently, there is a trend toward a period of self-determination where the federal government is trying to work with tribal communities so that they can determine their own successes, take over programs, for example, Indian Health Service programs, and have more self-determination and local control of the types of programs that they operate. But when you look at this from a historical perspective, and when we think about the different periods of types of federal policy toward American Indians, there's been a long history of significant social injustice and violation of civil rights, and in many ways, movement toward genocide of the original inhabitants of this land. And of course that has an impact on health, and it has an impact on self-identity, and it has an impact on one's sense of hope for the future. So when we think of social determinants of health, those federal policies that were so destructive to tribal nations have a direct impact on behavior at the individual level. And that's why we've seen so much despair historically.